we will talk about different murmurs and effects of maneuvers. I had a hard time understanding these effects until I broke everything down. So let's start. When you have a question in your exam about one of these maneuvers, first thing you want to figure out is, does this maneuver affect preload or afterload? The next step is to figure out what does it do. For example, does this maneuver increase preload or increase afterload, or decrease preload or decrease afterload? I have given you guys most important examples for each one of these situations. But this chart is true for any maneuvers, which are not listed here. So let's start with preload maneuvers. With given maneuvers, you either increase preload or decrease preload. Examples of increase in preload are leg raising, squatting, or anything that increases the venous return. And examples of decrease in preload are standing, Valsalva, or anything that decreases venous return. Now let's break all the murmurs down into two groups of preload maneuvers. First group is aortic stenosis, mitral stenosis, aortic regurgitation, and mitral regurgitation. Second group is hypertrophic obstructive cardiomyopathy and mitral valve prolapse. Reason for these two groups are that murmurs in the same group has similar effect with any given maneuver, and all the murmurs in other group have opposite effects with same maneuver. Remember that question might tell you that this patient has mitral stenosis or aortic stenosis, or a question can describe the symptoms and describe the murmur. So if you don't know how to recognize the murmur by symptoms and description of murmur, you can watch my video on valvular heart disease. Okay, so back to murmurs. With increase in preload, first group of murmurs, which are aortic stenosis, mitral stenosis, aortic and mitral regurgitation, increases in the intensity, which means they get worse as preload increases. With increase in preload, second group of murmurs, which are hypertrophic obstructive cardiomyopathy and mitral valve prolapse, decreases in intensity, which means they get better as preload is increased. Now let's move on to the decrease in preload, which is due to standing, Valsalva, or anything that decreases the venous return. For these maneuvers, first and second group of murmurs have opposite effects compared to increase in preload because you have opposite hemodynamic changes in patient's heart. So first group of murmurs, which are aortic stenosis, mitral stenosis, aortic regurgitation, and mitral regurgitation, decreases in intensity, which means they get better as preload is decreased. And for second group of murmurs, you get opposite effect, which means decrease in preload causes increase in intensity or get worse. So this is all you need to know for preload maneuvers and murmurs. First, look at the murmurs and see how it affects preload, and then see what kind of murmur is given and you're good to go. Afterload maneuvers are a little bit more complicated, but if you use same concept and break things down, then they're easy to understand. Let's start. So first, what you need to know is what happens to the afterload with the given maneuver. Amyl nitrate, which dilates arteries, or anything that increases the outflow of the heart, causes decrease in the afterload. Hand grip, or anything that decreases the outflow of the heart, causes increase in the afterload. For this, we also have to break down our murmurs into two groups, which are forward flow murmurs and backward flow murmurs. First group is forward flow murmurs, which are all your obstructions. Examples are aortic stenosis, mitral stenosis, hypertrophic obstructive cardiomyopathy, and mitral valve prolapse. As you can see, All of these diseases cause the obstruction of forward flow. And second group includes all of the backward flow murmurs, which are regurgitations and VSD. So let's move on to see what happens when we have decrease in the afterload, which means less blood in the ventricle. All of our forward flow murmurs increases in the intensity, which means they get worse as you decrease the afterload. Here we said all obstruction murmurs get worse when we have less blood in the ventricle. Opposite must be true when you have more blood in the ventricle, so all obstruction murmurs or forward flow murmurs must get better when we have more blood in the ventricle. You can see that in the side of the screen. All obstruction murmurs get better, which means decreases in the intensity with any maneuvers that increases afterload. All you need to know for this is all forward flow murmurs get better when you have more blood in the heart and get worse when you have less blood in the heart. Now let's talk about backflow murmurs, which are your regurgitations and VSD. So when you have a decrease in afterload, which means less blood in your ventricle, all backflow murmurs get better because more blood is flowing back to the heart during regurgitation. So opposite must be true when you have more blood in your ventricle, which means all backflow murmurs must get worse or increase intensity when you increase afterload. Remember to follow these steps, and this way, even if you get some weird maneuver for your question, all you need to know is how does this maneuver affect preload or afterload, and you can answer any USMLE question about murmur and maneuvers. I hope this helps you. If you want this flowchart, please send me an email at usmlesaver@gmail.com and I will be happy to email you this picture. I am currently working on more USMLE Step 2 CK videos like this one, so if this method of learning interests you, then feel free to leave comments and suggestions. Thank you guys for watching this video, and I hope you have a great day. Good luck studying for your USMLE.